Good morning again, everyone. Welcome to our monthly office hour session for health-related social needs service providers. My name is Tanya Curiel, and I'll be facilitating today's session. I'm with the Oregon Health Authority's Transformation Center, and I'm a policy analyst. Next slide, please. All right. For folks who are new here, a few Zoom tips. Today we'll be doing office hours where you have the opportunity to ask Oregon Health Authority staff questions about health-related social needs services. And for that office hours session, we will be using the questions and answers function of Zoom. So if you haven't used that before, you can take that opportunity now to find it. If you are on your computer, you'll likely see that at the bottom of your screen. If you can't find it, there are three dots on the bottom right that say more, and it might be hiding there. If you are on your phone, it might be at the top of your phone, but look around for it. It'll say Q&A, and that's where we ask you to please submit your questions. Additionally, this session is being recorded. We like to post the recording afterwards for folks who might want to review something, or if you missed the session, you can also go back to that recording. There's also closed captioning at the bottom of your screen. So if you would like closed captioning, click the CC button at the bottom or top, depending on your Zoom account, but the closed captioning will be there. Next slide, please. All right, and our agenda for today. So we're going to do things a little bit differently. I'll try to explain that in a moment. So as usual, we start with the welcome and introductions, and then normally we go into some HRSN updates. Today we are going to dive right into office hours. We're going to have time to get your questions answered. We'll wrap up our normal session with upcoming opportunities. And the different part of today's session is that we are saving the last bit of our time together to have a conversation about the 1115 OHP waiver renewal update and have a conversation about that. The reason why we're saving this for the very end of our session is because we want to dedicate that space for HRSN service providers to offer feedback on the waiver renewal. I know that normally this session is for HRSN providers, but we have attendance from other folks, CCOs and others just interested in listening to updates about HRSN. So this is our very friendly way of saying we really want to dedicate some time just for HRSN service providers. So we'll wrap up the session and then ask that that space be just for providers. So we'll talk a little bit more about that. But we'll go into our office hours. Next slide, please. All right, and office hours. So if you are new to our office hours session, next slide, please. So if you're new here, this is your space to ask us, the Oregon Health Authority, specifically our subject matter experts in all things health-related social needs. It's your time to ask us questions about HRSN service delivery. You can share what's going on in your world, questions that feel pressing this month, and we will do our best to answer your questions. The only thing we ask is that you do not share case specifics. So if you need to get into the nitty-gritty of a case you're dealing with, this might not be the best place, just so we're not sharing confidential information. We also ask that you share suggestions and ideas. If you've learned something in your work recently that you think would be helpful, please do share that. It might be helpful for other folks providing HRSN services. And then we ask that we focus on questions from our HRSN service providers and community partners. The way that we ask that you submit questions is with that Q&A box that I mentioned as we were getting started today. That just helps us stay a little bit more organized. You can also raise your hand if it's just easier for you to say your question out loud. All right, and with that, we're opening it up to your Q&A. So if you have any questions for us, please go right ahead. Let's see the Q&A box. Okay. Looks like we got one question answered. Keith, go ahead.
Hi, thank you. My first time attending. I'm excited to join. I'm a new employee at the North Coast Food Web. We're going to service Clatsop County. Uh, I understand that there was some final documents provided on May 1st for the fruit and vegetable program and billing for the fruit and vegetable and pantry stocking. Where can we get those?
Thanks for the question. Looks like Teresa's ready to answer. Go for it.
Hi, Tanya. Sorry about that. Hi, this is Charissa Young White. My pronouns are she, her, hers. I am with the Oregon Health Authority on the health-related social needs team. I apologize, I'm not on camera, so I wanted to describe myself. I'm a 40-something-year-old white woman with glasses and brown hair. And I apologize for not being able to, for you being able to see me. So that billing guide, we can send that over to you. Will you send an email to hrsn.program@oha.oregon.gov? And Leah just put it in the chat for us. Keith, this will be public. This, oh, wait, correct me if I'm wrong. Chelsea, was this published? Actually, do we have the link?
It is
I
published
am so
on this.
sorry. I don't have to email it to you, Keith. We will put the link in the chat right now. And just be aware that it is the full billing guide. It is not only fruit and vegetable and the pantry stocking benefits, but you'll see in the table of contents where you can go directly to that section. So we'll get that pasted right away. Thanks, Keith.
Thank you.
Thank you both. Chelsea, if you wouldn't mind, you can stop sharing screen now, then we can all look at each other. Jacqueline, go ahead.
Hello, everyone. I just want to say thank you for updating those FAQs. I did notice in there that one of the things that's been updated is how the 30% AMI is determined and what documentation is needed. And I understand that the recent changes in income, such as job loss, reduced work hours, or changes to cash benefits, should be taken into account when calculating that 30%. And I'm just curious what the best practice would be for calculating that 30%. Something that I was working with our HRSN case manager is just that we have at our agency an ROI which does allow us to contact past and present employers. So I'm not sure if reaching out to the employer would be best practice to just confirm that that job loss did take place, in addition to providing those previous 60 days worth of income, um, or how we should go about doing that aside from just self-attestation, which I understand is also an option.
Thanks for the question, Jacqueline. Um, who can answer
Hi,
this
good
question?
morning.
Sarah, thank you.
Hi, my name is Sarah. I use she, her pronouns. I'm here on the OHA HRSN team, and I'm one of the housing policy analysts. Jacqueline, that's a great question. If you have mechanisms in place at your agency to reach out to employers, that is completely fine. The intent of our update is to allow flexibility so we're not creating more barriers for our members or our providers. So if you have those ROIs in place and that's aligned with your practice, totally fine. We were just trying to make sure that we're giving a comprehensive way of evaluating. Does that kind of help answer your question, Jacqueline?
Yeah, it does. And with our agency, kind of the way that we do things with other programs, is that we calculate that 30% AMI over annual calculations. So I'm also curious just how would that look when we're filling out that budget worksheet and we're talking about annual income? Are we just utilizing the past 60 days as annual in or like, the past 60 days and then whatever they've worked, say they've worked up until May, that would account for the entire annual portion when we're filling those pieces out? Because I know that with customer service, they really want that information filled out. They're not going to let it go.
Mhm.
So I want to make sure that with as little barriers as possible, we're
Mhm.
getting all the information provided so that they can be considered having a complete referral fulfilled and
Mhm.
put in for review.
Yeah, I think one thing I would just encourage is if there is like a immediate change in income where the person is not working, counting equal to last 12 months does not make sense because the person has no income at this time. If you have like a specific case that you want us to review without giving any personal PII, I'm happy to look over it with you, make sure I'm not missing any parts of this. But you're welcome to email the HRSN email or myself directly, and I can definitely provide you more one-on-one support. So again, we're trying to open up, remove barriers, but I hear your question as well. So I don't want to conflate or misspeak until I see your exact examples. So yeah.
Okay, yeah, that would be amazing. I would love to just see how this works in practice so that moving forward, as we are even presuming a person eligible and putting in those referrals, that we have that accurate
Okay.
moving forward.
I appreciate that. Thank you. Yeah, we'll connect.
Thank you so much.
Thank you. And there is a clarifying question from Jennifer about where we can find that updated FAQ that Jacqueline was referring to. And Trissa, I don't know if you wanted to answer that one.
Sure. Hi, this is Charissa with OHA again. Jacqueline, I just want to be clear before I provide the link.
There it is.
You were talking about, oh, you got the CCO FAQ there already in there from 5/1. Okay, great. Thank you. Jacqueline shared the link. Appreciate that.
All right. And I'll read the next question that's in our Q&A box. This is about HRSN rental assistance. So the question is, we've run into an issue with HRSN participants losing their rental assistance when they go into SUD treatment. CCO is telling us that they're leaving housing for several days or weeks, and that's considered them moving out or leaving housing. So their assistance ends and it cannot be restarted. Um, have we heard about this? Because it's causing an issue. Is there an alternative solution? Sarah, maybe?
Hi there. This is Charissa again with OHA. And I think that we need to look at this one more in depth offline. Nathan, will you email the HRSN program email? And it is interesting. I don't want to speak to this without further information. I see that Jesse, the director of this team, just came on camera. Did you have something, Jesse?
Yeah, thanks, Trissa. And hi, folks. Jesse Wilson, she, her pronouns, 1115 Waivers, Strategic Operations Director. I would like some more information, but on the surface, if there is still an active lease agreement in place and that member has not vacated that residence, initial thoughts are that should still be allowed. The intent behind the move not being covered by HRSN is if they are moving to another address, there's no longer a valid lease agreement in place for their current address. So a temporary stay at an SUD facility should not impact that. But I'm wondering if there's still an active lease agreement in place.
Yeah, Nathan, go ahead.
So there's just some ambiguity there with because as we all know that some people aren't really sure how long they're going to be in treatment for. They're not sure what they're doing after treatment. So we're just trying to support them any way that we can. And typically at this part of their life, they can't say, "Hey, I'm going to be back on this date." So we just aren't sure what to do with the lease. What like, do we go through an eviction process and then let them come back? 2 weeks from now, 3 weeks from now, whenever their treatment is done, do we need to just keep them on the lease and save their bed and sometimes they're not even so it's kind of a definitely a tough issue that we're trying to kind of work through. So it would be good if we could get some heads on it.
Yeah, that's helpful context. Thanks, Nathan. Let's follow up on that because I think that's a good question. If there's uncertainty on the return date, then that brings into question too, like the 6-month benefit, but also potentially I'm sure there's probably concerns with capacity too at certain units that may want to provide services to additional members. So
Right. Yeah, it's been an issue. So I really appreciate you guys. That's awesome. Thank you.
yeah, we'll follow up on that. Thanks so much for bringing that question.
Thank you so much. There was a clarifying question that we got in our Q&A box about our AMI conversation like a minute ago. So I want to raise that one up again before we move on to something else. The question is, can you please explain how OHA determines the 30% AMI income limit? Is it by number of members in the household, a strict 30% of self-attested income, etc.? We could clarify that.
Oh,
Sarah.
apologies.
Thanks, Sarah.
Good morning. This is Sarah Quick again. She, her pronouns, OHA, Medicaid team, policy analyst for housing. My computer's acting a little funny here. I hope you all can hear me. But regarding income, I would just encourage you to follow. There's multiple ways that we can calculate that 30% AMI, but we do have some guidance that we can share with you, some documentation. Basically, we're wanting to offer flexibility, but you're going to be counting members who are contributing to the cost of living in the household. I'm sure one of my other housing team members can also chat in here to offer more clarification. While we are discussing income and income limits, I just want to pop back to some questions in the chat too. And regarding live-in aids, a live-in aids income would not be counted as part of eligibility screening for HRSN.
Great. Thank you, Sarah. All right, we have another question about, ooh, that one disappeared on me. Thanks for answering it, Teresa. Let's see. Okay, a question about leases. If a member is approved for HRSN and the person their lease is with changes, but their address does not, does that affect the approval for HRSN rent benefits?
Hi, thanks for the question, Alexandra. This is Charissa with the Oregon Health Authority again. I want to make sure I understand. So a member is approved for HRSN rent and utility assistance, and the other person that was on their lease moves out and a new person moves in, let's say. I think that's your question. Correct me if I'm wrong there. Their landlord changes. Okay, is with the person their lease is with changes. Thanks, Alexandra. That is quite a different distinction. Okay, so restarting. If a member is approved for HRSN and the landlord changes, but the address does not, I can't think of any situation where that would affect their rent and utility assistance benefits unless the landlord, the new landlord, does not provide a W-9 and there is no way for payment to be made. That would be the only reason. So it would be the new landlord says, nope, I'm not going to give you this W-9. There's no way to pay us. We've had this happen. Then that could possibly be a problem. But it wouldn't affect the approval for the rent benefit as far as the Oregon Health Authority is concerned. That wouldn't affect that person is authorized and approved for that rent and utility financial assistance. And if they did not move, but their management company or the landlord changed, that is not within their control. So I don't think that should be a problem. However, if you do come across this, please email that email again, HRSN program email, just making sure that I understand the entire situation. If anybody else disagrees, then Sarah, Tara, let me know, but I don't think it should affect that.
I see your hand, Nathan. I'll wait one moment to see if anyone has anything else to add for this. All right. Thank you, Teresa. Nathan, go ahead.
Just kind of along those same lines, another issue, excuse me, that we've been running into is so we do recovery housing, And we have several addresses, in the umbrella of our recovery housing. And sometimes people that are getting this benefit run into issues with other tenants, or, I mean, there's a barrage of reasons why we might need to, but sometimes it's in the best interest of the tenant to move to one of our other houses, in which case we have to reset their lease and change the address, which of course now we've run into issues with them losing their rental assistance because the address on their lease has changed. However, they're still under the umbrella of our organization and still, living with us technically. But they lose their rental assistance. Have you guys heard of that? Or is there anything we could do about that?
Hi, Nathan. Thanks. This is Charissa with OHA. I think we need to look into that a little bit more and get some more details on that. Would you email HRSN program? I'm,
Yes, absolutely.
I'm not sure I'm understanding the full scope, and I just want to make sure that I don't provide information that is not quite right for you, of course. So thank you.
Of course, thank you.
Jesse, I saw you popped on camera. Did you
Yeah,
have something to add?
I'll just add our current rules do not allow for an address change, regardless of the circumstances, to continue the benefit at a new address. We
Right,
are,
that's my understanding too, and that's what we're doing, and that's fine. Just wondering if we could get some leeway in some situations, just because of the reasons that I explained.
yeah, we're looking at where policy improvements could be made. So we'll take a look at this, but as current rule stands, that would not be allowed. But yes, please send us that, and we will take a look into it further. Thank you.
Thanks for the question, Nathan. All right, let's see what's in our Q&A box. All right, a question about housing. I'll read this one from Bree. We have a member who began receiving HRSN housing services in February and received an eviction notice in April for reasons due to non-payment. We issued rent assistance for the authorized months of February and March. Since they had a court hearing mid-April, the landlord requested we not issue payment for April's rent until the hearing occurred. They have since followed up and requested rent payment for April. We verified the member still has active OHP and did so for the entire month of April. Are we able to submit back payment for this member's April rent? There's a
It's Bree. Sorry. Also, I just wanted to clarify, I apologize. It was for reasons beyond non-payment. So we had issued payment for February and March. We went to issue payment for April. Then the landlord asked that we didn't due to the court hearing that was happening mid-April to determine if clients were going to leave for reasons beyond non-payment. But they ended up staying the entire month of April. So that's why we're wondering if we're able to do the back payment for April rents as it would be consecutive, or if because the lease was ending for reasons beyond non-payment, if we're not able to do so.
Hi, Bree. This is Charissa with OHA. So this is interesting. We might need an email on this one too. I hate to do that to you, but there's a lot of nuance here. But what I would say within our rules, if the member was authorized for 6 months of rent and they are continuing to live in that home where they have a lease and where the authorization was approved for, sorry, so many words that sound the same, then I don't see why not, is if they're residing there for the entire month of April. Any Sarah, Jesse, anyone disagree? It feels like we would follow the authorization in this situation, regardless of outside sort of reasons for eviction. They were not evicted in April. And if that's consecutive, like you called out, it is still authorized rent assistance. Sarah, anything else to add there?
I'm wanting to almost review the notices from the court to make a more informed decision. I think I'm in alignment with you, Charissa, but I guess the I think so. But I think having an offline email might give us the best, most informed response. I'm so sorry. I agree. I wish I could just give an immediate answer, but I don't want to misspeak and create more confusion for our providers or for our members.
Yeah, absolutely. And Bree, feel free to email us. You can also contact, if this is an Essentra client, you can contact Essentra and talk to them about that, or the CCO if you'd prefer. But it sounds like it would be illegitimately paid, and we wouldn't consider that back payment or rental arrears, just to be clear, when we're talking, that would be part of the forward rent that was paid under the HRSN authorized approval. Thank you.
Okay, thank you guys so much. I'll work on compiling an email and sending that just for further approval, I guess, of this case. And thank you guys for the insight on it. We appreciate it.
Hi, could I jump in real quick? I work with Bree. I'm curious what we can totally send an email and just like thinking about trying to make the process as like streamlined and like quick as we can. I'm curious what on the eviction notice, and I don't know if you can answer this, but like what would it on that notice would impact if we could pay it or couldn't? And maybe that's too like complex of a question, but I'm just curious for our own learning.
Can you repeat that, Megan? This is Charissa again. I apologize.
Yeah. No, you're good. I'm just curious. So if we were to like send a copy of the eviction notice, like or more information about it when we send it an email, I'm curious like what from that notice would impact OHA saying, yes, this seems like a cost that you should pay, like not paying it would be reducing the benefit, or on the other hand, say like, no, that would not be a legitimate payment to make because of the
Gotcha.
eviction.
Gotcha.
Yeah.
Understood. We understand. I think the only reason for additional information would be just to verify the dates. Again, if they are authorized for 6 months consecutively,
Mhm.
if there is some nuance, the only other thing would be we do have this is intended to improve housing stability, reduce
Yeah.
eviction prevention. And so if a member was already evicted and didn't have housing stability, there could be some nuance there that we would want to look at, Megan. So that's
Okay.
where we're thinking. But again, I really think if someone is authorized for those benefits, and they should be paid through April because they were authorized and they weren't evicted, it
Mhm.
most likely should go through.
Okay. Awesome.
Thanks for
Thank
the
you.
clarification, the additional
Yeah.
questions. Everything is difficult with these policies because there's so much nuance about everything. So thank you so much for following up.
Thank you so much. And I think we missed a question. So I'm going to read that we accidentally marked it as answered. Sorry about that, Teresa. This is a question about households. So I recently came across a couple members who have a partner or roommate that lives in the house and is listed on the lease. Not married, no children together, did not file taxes together, not on OHP together. One of the members had Care Oregon contact her, and in the conversation, she was told that the entire rent amount would be paid. They just needed the other person's income or a self-declaration letter of no income. Others in similar situations, there's also others in similar situations. So I'm curious if a roommate wants to be included on the HRSN and if the member wants that as well, are they allowed to do that if the income is counted or the self-declaration letter is obtained?
Hi, Teresa. This is Teresa. Sorry if I pronounced your name wrong. This is Teresa with OHA, similar names here. I'm taking a look at this. The rent and utility financial assistance benefit is limited to one per household per through the demonstration waiver. So what this means is a household is determined by their Medicaid eligibility. However, because this is rent and utility financial assistance, it could cover other folks' bills of the household, right? So you could have one OHP member, and let's say they're roommates, so they're not married, there's no children together, they don't file taxes together in your situation. We have one member that applies for the rental benefit and is approved. They could do one of two things. They could request that just their portion of the rent is paid, and therefore that would cover, let's say half, let's just call it half of the amount on the lease. And their health plan pays that, and the service provider pays that. The other person in the household could also apply and receive their half of that portion of the benefit. However, if one person is on OHP and applies and gets the entire rent paid for that household for 6 months, and the other person, the roommate, says, "Oh, I am eligible now. I would like to get some rent and utility financial assistance." They would actually not be eligible because they were on the lease and part of the authorization for the previous member. So really, they just are, they're entitled to their portion of the rent either way. So it really just depend on the situation and what the member's choice would be. I would have to say that most likely, Care Oregon is thinking they're probably just going to pay the whole rent and so use the income for the household and both members receive the benefit. That is probably what happens most of the time. But the member can decide that they just want their portion only, and then that would leave other folks in the household available for the rent benefit in the future. So essentially, if the income is counted, it would just depend on what the member requests. If they only want to look at their part of the lease, then the income from their roommate would not be required. If they want to get paid the entire lease amount to be paid, regardless of roommates, then all the income in the household would be required.
Thank you for your answer to that, Teresa. Does that answer your question? Teresa? Is it Teresa or Teresa? I'm sorry. Just want to make sure I'm saying that right.
It's Teresa.
Teresa. Okay, thank you.
Thank you.
All right. We have a question from Wendy. What about when a new owner takes over a property and has no records from the previous owner, including rental lease records? The tenant will not sign a new lease with new owner since it means new rules and new amounts. What do we use in lieu of a signed lease?
Hi, Wendy. Thanks for the question. This is Charissa with OHA. Unfortunately, the quick answer is we require a lease agreement, a rental verification form signed by the landlord, or another type of written agreement. And we can reference our 41012020005 rule for that. But a lease is required to receive the HRSN rent and utility assistance benefit.
Okay, thank you. Let's see. Okay, this is a good question from Ezra, and this is more of a question for everyone in the room. So we had a question about someone who owes more than what a 6-month rent benefit will cover. What are other providers' experiences with using HRSN to help a person with back rent that doesn't bring their balance back to zero? This can be answered by anyone. I'm mostly just curious. Thanks for that question, Ezra. So if anyone in the room has anything they think would be useful for Ezra to know, feel free to speak up. And I'll read that question one more time. We had a question about someone who owes more than what a 6-month rent benefit will cover. What are providers' experiences with using HRSN to help a person with back rent that doesn't bring their balance back to zero? This can be answered by anyone. I see we had Katrina write something in the chat. I'll read that, and I see someone came off
And
camera.
Tanya,
Yeah.
I wouldn't mind, I wouldn't mind answering this. And then if
Oh, yeah,
anybody's
go
got
ahead.
anything to add, that would be great. But there are a few different scenarios that might happen where someone owes additional rent beyond the 6 months that HRSN could pay. In some of those cases, if paying the rent would not remedy the housing situation and would not keep the member housed, then it could not be paid. So in those cases, if the landlord would evict anyway, and there was no way to otherwise mitigate the situation, then HRSN could not pay the rent. But what could potentially happen is some negotiation with the landlord through tenancy services or through O&E, depending on the member's eligibility situation. And the landlord might be willing to make some sort of a payment plan that would allow the member to remain housed and then either seek some additional rental assistance to braid together or continue to make those payments on their own and remain housed. So if the situation can be remedied in a way that follows the rules and keeps the member housed, potentially that could be paid.
Thank you so much, Tara. And would you mind introducing yourself?
I'm so sorry. Yes,
Are you good?
belatedly. I'm Tara Gray, she, her pronouns, and I am one of the housing policy analysts here at OHA on the HRSN team.
Thank you. I'm trying to be better about that. And thank you. I see we're getting some great comments in the chat. I know I saw maybe one or two folks come on camera. Did anyone have anything to add verbally?
Yeah, I could. What Tara said was great. That's what we do. And the only thing I would add is we'll work on like budgeting with clients to figure out like, okay, can you pay this if we make some like we plan out all your expenses? Is there a utility assistance? Well, not that, I guess if it was more than 6 months, but like other community resources that aren't rent, if rent isn't available, to help free up some money so that they can get current. So that can be helpful.
Thank you so much, Megan.
Yeah.
And I'm going to read out a couple of things that were said in the chat. Katrina said, we try to partner with other agencies to get other rental assistance. We also work with the tenant and landlord on a payment plan to avoid eviction. Jacqueline wrote, if we can't braid funding with other resources, we require an agreement for payment arrangement between the landlord and tenant. And Joshua suggested, look into other resources and funding, see if you can negotiate with the landlord to avoid eviction. So thank you all for adding to that conversation. Appreciate that. I'm going to read another question in the Q&A box. This is on O&E and tenancy from Tiana. Is there guidance for outreach and engagement / tenancy on emails exchanged from provider to landlord or utility company? Phone communication is clear, but is there a certain amount of emails that equal 1 unit? Teresa?
Hi, Tiana. Thanks for the question. We don't have a policy on this. I would say because these are time-based codes, estimating the time you spend on crafting these emails and sending those emails and adding that to the time you're spending with the member to be able to bill for those services. So there is not like, let's say 10 emails doesn't equal 8 minutes and get you to that 1 unit. It's really about how much time you're spending working on this specific member's case and or with the member. Feel free to email if you want to talk more specifics about this, of course, though. Thank you.
Thank you so much. I do appreciate that. So I just want to have like a follow-up question. So is it only the time that we're spending like crafting our response? Like if we have to do like additional math on the ledger, and then we add that into the email, is that like, like running a clock kind of thing? Or we just kind of estimate like, oh, we maybe spent like 30 minutes on an email exchange between us and the landlord trying to figure things out, and we're counting that as like 2 units. Just kind of wondering of like, is it only our response time that we're using to like craft the email to send it out?
No, thanks, Tiana. That's a great
Mhm.
clarification. So for outreach and engagement and tenancy services, and I can't go over all the activities that are covered off the top of my
Right.
mind, and I know you don't expect that, but activities, let's say for outreach and engagement, spent connecting the member to services, including HRSN,
Mhm.
making sure that the information and the documentation is submitted to either the health plan or a different service provider, etc. Those activities should be covered. So how
Okay.
you handle that, it could be like a rolling clock. I understand what you're saying. So I was talking to the member on the phone for 7 minutes, and then I
Mhm.
went to look at their data and pull up the numbers, and then I send the email. Yes, all of that can be added up to get you to the appropriate time or units to bill for that.
Okay.
And I would say, you want to be careful in your documentation, of course. This is a Medicaid benefit. It's incredibly important, but we're looking at, second by second and setting a timer or a clock like
Yeah.
that is not exactly what we're looking for. So,
Mhm.
yeah. So I would say if you spend, 10 minutes doing work with the member, definitely bill for that
Okay.
full unit there, including
Okay.
almost all the work that you're doing. I just want to note that some administrative costs, like actually invoicing the health plan, that's not covered for outreach and
Mhm.
engagement. So those are the only activities that are really not the only, though that's an example of an activity that is limited by the benefit. But the activities you're
Mhm.
talking about, Tiana, absolutely.
Yeah, we find ourselves you know, sending more emails than we do phone calls. So I just wanted to see if there was like a clarifying thing that I could, notate for us just to make sure that our units are accurate, and we're not trying to like run the clock forever and bill like 50 units in one day. We just want to make sure that we're billing accurately for like the amount of time we're spending communicating between like provider and property manager or something like that. So just wanted to see if there was like an OAR for that, or if we just kind of have to use our best judgment for it. But it sounds like best judgment is the answer.
Yes, I
So thank
think in
you.
those situations, definitely reference OAR for the actual
Mhm.
activities. But yes, absolutely, Tiana.
Okay, perfect. Thank you so much.
Thank you. And there's an O&E one, Tanya. Can I just jump to that really quickly?
Yes,
'Cause there's another
please.
O&E one. Okay, great. Joshua asked, recently we learned there was a clarification regarding how many units you authorize for when opening cases. So it's 120 units total across O&E, tenancy, etc. Correct. Let's start with that first question. 120 units would be, if I recall exactly, but that is the 30, I'm sorry, there's a 30-hour max from the first date of service for each member within a year. So they have 30 hours for outreach and engagement. That 30 hours translates into 120 units because each unit is 15 minutes. So the max authorized for 1 year for each member for outreach and engagement services is 120 units. And actually, I should step back that slightly. It does not require an authorization from the health plan. As long as the service provider is documenting that the member is an Oregon Health Plan member, confirmed and presumed eligible for the outreach and engagement services, they're able to bill. And that 120 unit max is just for outreach and engagement. Now, for tenancy services doesn't have a maximum limit. To my knowledge, there is no service limit. Tara, correct me if I'm wrong, but I don't believe so. And so for tenancy services, it doesn't fit into that 120 units. No. Tenancy services does require an authorization, so is authorized by the health plan, and they would monitor and work with you on tenancy services and what would be billable there. But there is no set limit. So those are technically not connected benefits, although they're very similar, of course. And then I would like to just make sure, Joshua, when I'm looking at opening cases, that's not something I think you're probably talking about in a referral platform. And so I'm not answering the question when it comes to actually opening cases in a referral platform. That would have to be discussed, probably not here. It would depend, though, and with your coordinated care organization potentially, or a Centra if you're working with them on that. So I don't have good clarification on the way that a case is opened, et cetera, but I can tell you that 120 units is the limit for outreach and engagement, and for tenancy services, there is no limit. Thanks.
Thanks, Charissa. All right, I am going to do a little time check for us. I think we have about 10 more minutes allocated to our Q&A time. So I'm going to prioritize the questions that we have coming up. And so if you ask a question after that, we might not have time for it, but we'll try to get to as many as we can in the next 10 or so minutes. And then please stay with us because we'll have a conversation about the 1115 waiver renewal. So just a little time check, but I'll keep going. There was a question from Tyler about owing more than 6 months of rent. So I'll read that question. What is the policy for clients owing more than 6 months? We have been getting agreements from the PM that the client will not be evicted regardless of the 6 month HRSN full assistance not paying the full balance. This is if the remaining balance is over $1,000 or 3 months. Does this sound right? Trissa, Tara, Sarah, who wants this one?
Yeah, Tara or Sarah, can you talk through this one?
And I'll read it one more time. So for Tara or Sarah, what is the policy for clients owing more than 6 months? We have been getting agreements from the PM that the client will not be evicted regardless of the 6 month HRSN full assistance not paying the full balance. This is if the remaining balance is over $1,000 or 3 months. Does this sound right?
Tara, did you want to go first? You want me to jump in?
Oh, you know what? Go ahead. Go ahead, Sarah. I
Okay,
think
you
I
probably.
mixed up which question we were answering out loud. I'll go
Okay,
ahead and let you.
great. Yeah, so for this one here, this is Sarah from the HRSN team. I'm one of the housing policy analysts here. And, I don't know of any law or rule that states remaining balance over X dollars over X months. So if there's something negotiated between a property manager, I'm assuming a PM is a property manager or a landlord, and the tenant and the courts, that would certainly stand up. But I just don't know of a set rule regarding this. So if there's other providers on the line who are seeing trends here that want to speak up to it, I'm welcome to hearing that.
I just wanted to clarify. It's kind of like we're seeing people owe more than 6 months, but we're trying to figure out when we should get an agreement with the property manager. And that's where the 1,000 or 3 months comes in. That's like if it's over that, we decide that we'll get an agreement with the property manager that they're not going to get evicted for the remaining balance so that we can pay the full 6 months that are owed.
Gotcha. That helps. So yeah, that helps so much. Thank you so much, Tyler. So I think in that case, what I'm hearing is Charissa kind of touched on this previously, and a couple of the providers too. If I'm trying to braid all the responses together, if there is an agreement where the HRSN assistance, even if there is a balance, will not result in eviction because there's a payment plan or other braiding of resources, that is great. If regardless if it's $5 or $5,000, but if there is an HRSN payment made, but you as a provider know that eviction will still be upheld because there's a remaining balance, the landlord will not negotiate, that could be a bigger concern. I'm going to let Tara jump in case she can add more clarification from her experience there too.
Thank you, Sarah. And I agree with everything you said. And I would say that it does not matter the level of the balance, as Sarah was saying. There needs to be an agreement. There would need to be an agreement and a conversation with the landlord, because otherwise there's no guarantee that the day after rent is paid that an eviction wouldn't be filed.
Thank you, Tara, and thank you, Sarah. All right, our last question, and apologies that we lost this in the chat. This question is from Mavi about Unite Us. So recently, Unitas has sent many emails requesting submission of supporting documents for rental and utility support. Unfortunately, there is no member identifying information. When reaching out to Unitas, there has been no response or support addressing the situation. What would you suggest?
Hi, yes, this is Teresa with OHA. I would suggest reaching out to your coordinated care organization that you're contracted with, first of all. Unite Us is a platform that those health plans use, and they are in communications with Unite Us I think on a weekly basis is what it appears to me these days. So that would be the best route. However, we will also take this back internally and to our team and be monitoring it for trends and take a look at that. We can't advise necessarily on the specifics about Unite Us, but we can absolutely take this back and make sure that we are tracking this concern and challenge that you have. But definitely reach out, Mavi, to your coordinated care organization. And if you need help with that, just please let us know. You can email the HRSN program email as well. There should also be contacts in Unite Us. I know there are case managers and folks, but it sounds like you're already not getting a response. But I just wanted to call out, you could try a different contact. But yeah, first step would be your coordinated care organization. Thanks.
All right. Sorry. I have to close us out for our Q&A, and I'm so sorry to do that when we have such an engaged group, but I do want to make sure we have time for our next conversation. I see one question in the chat. We'll try to get you a written answer for that one as we transition to the next part of our conversation. Thanks for everyone's patience as a lot of our answers were, please email us. But I hope you know that we're doing our best to answer questions and just want to make sure that we get you the most accurate response possible. So if there is something that we didn't clarify well enough, or if you have follow-up questions, or if you need more information, please just email our inbox and we'll get back to you. I know we've also gotten some survey responses from folks wanting us to share out those follow-ups with the whole group. And I do hear that, and I know that you want to get all of the follow-ups, but sometimes they contain case-specific information. So if there's ever a conversation that you want more information about and we don't bring that back to the whole group, you're always welcome to reach out to us directly. And with that, Chelsea, if you wouldn't mind sharing your screen again, please. All right, I'm gonna kind of close us out, but not really. Please don't leave. We still have a second part to this conversation. I just want to make sure that everyone gets our upcoming opportunities. Don't leave. Next slide, please. Our next office hour dates are posted on our training webpage. We'll drop a link to that in the chat. They're Wednesdays, 8:30 to 10 a.m. Next slide. We value your feedback. I'm going to move us from the slide quickly, but I'll also drop the links for feedback in the chat. So next slide, please. And then I'll also put this in the chat, just the links to where you can find more information.